All right, well, I am Stephanie. I already introduced myself. I'm here with several of my Children's Health Watch colleagues, yay, and this work is part of my work with Children's Health Watch. So there's been a whole lot of work on adverse childhood experiences. These are harmful experiences that people will have had before the age of 18, divorce, neglect, parental substance use, etc. In research, that these are counted up and used as a count, and people with a higher number of ACEs have had a greater impact on their health. So more mental health issues, cardiovascular conditions, earlier mortality, etc. And there's been a really big move across the country to start screening people, including children, for ACEs and to like incorporate that into clinical care. It's a really deficit frame and somewhat deterministic, and often, not always, in the way that it's rolled out. So there's been growing evidence and also a movement to sort of shift the frame and go to a more strengths-based viewpoint, and that's something called positive childhood experiences, or PCEs. What's right in your life? How can we do more of that? And so for children, this is, again, experiences before the age of 18, safe, stable, nurturing relationships and environments that promote good child development, good health, all the things. And there's been a growing body of evidence working on connecting PCEs to health and demonstrating in adults that PCEs, so those experiences before the age of 18, are related to better health and a potential role in buffering ACEs. But there hasn't really been a whole lot of work looking at intergenerational impacts. So that's where my work through Children's Health Watch comes in. We have a large data set of families with very young children, kids under the age of 4. So we added these questions to our survey, and of about 2,000 families, parent-child pairs, almost 2/3 had 3 to 5 PCEs, so higher level positive experiences, and those were in turn associated with better child health, better parent health, lower anxiety, depression, risk of anxiety and depression, lower risk of developmental risk among children, so less likely to have developmental delays. Fair poor child health was borderline significant. We're actually adding more data to try and rerun it. We think it's a sample size issue, and less likely to have material hardships, which are in turn associated with a host of poor child and adult outcomes. So what does that mean? It means that the positive childhood experiences actually have a multi-generational impact. Those positive early experiences protect caregivers' future health and also their children's well-being. And so we can think about, in the policy sense, investments in children's positive experience actually benefit them and the future generation. And I think there's also sort of in the social service and clinical aspects some thinking about long-term intergenerational outcomes of those positive experiences could help us reduce our bias towards families that are low income, struggling, et cetera, and help us think about some more innovative strategies. And like I said, policies. So we can think about, I know this is a busy slide, but policies that can lift up. So if we think about PCEs as a trajectory and more PCEs as better health, things that lift up that trajectory across a child's lifetime would be things like the expanded child tax credit. There's loads of evidence about how it supported parent mental health, parent physical health, their feeling of self-efficacy as a parent, guaranteed income programs, investing in household stability, childcare, housing, thinking about health insurance and health care and making those affordable, accessible, high quality, healthy food. Transportation is a really big one as well. But they all have to be, with equity and inclusion in mind, not a popular thought these days. And things that push that trajectory down would be things that are restrictive, exclusionary, things that regressive policies, punitive policies, adding work requirements, administrative burden, which frankly are things that are all on the table at the moment. So I think we can think about them not just in the now, but also as what's the impact for the next generation if we put those things in place. And that's it.